Hello, I am Dr. Josee. Today, I'm sitting down to answer some of the most common questions my patients ask about type 2 diabetes. But before we begin, please remember, this video is for educational purposes only. Always consult your personal physician before making changes to your medication or diet. We share conversations like this regularly. If you'd like more clear and practical health information, please consider subscribing to our channel. Alright. Let's dive right in. Question 1. Doctor, I just got my results. Why did I develop type 2 diabetes? That's the very first question almost everyone asks. Think of your body like a high-performance engine. Normally, when you eat, your body turns food into sugar, also called glucose. Your pancreas then releases insulin, which acts like a key. This key unlocks your cells so the sugar can enter and be used as energy. But in type 2 diabetes, it's as if the locks on your cells have become rusty or jammed. We call this insulin resistance. The keys are there, but the doors simply won't open. So the sugar stays in the bloodstream instead of entering the cells. Over time, the engine starts to overheat. This condition is usually caused by a combination of genetics, the blueprint you are born with, and environmental factors, such as lifestyle. Question 2. What is the difference between type 1 and type 2? And am I at fault? I want to be very clear about this. No. You are not at fault. Type 1 diabetes is an autoimmune condition. In this case, the body stops producing insulin entirely, meaning the body no longer makes the keys. Type 2 diabetes is different. The body still makes insulin, but the cells stop responding properly. It's more like a communication breakdown. The keys exist, but the locks are not responding. Lifestyle can influence this condition, yes. But many people live healthy lives and still develop it because their family history made them more susceptible. Here in medicine, we don't focus on blame. We focus on management and improvement. Question 3. Why does my blood sugar spike even when I haven't eaten? This is something we call the dawn phenomenon. Your liver acts like a backup battery for sugar. During the early morning hours, usually around 3 or 4 a.m., your body prepares to wake up. It releases hormones such as cortisol. These hormones signal the liver to release sugar into the bloodstream so you'll have energy to start your day. But when insulin isn't working properly, that sugar remains in your blood. So you wake up with high blood sugar levels, even though you haven't eaten anything. So no, it's not your breakfast's fault. It's simply your liver being a little too helpful. Question 4. Is prediabetes just diabetes? I actually prefer a different phrase. I call it a window of opportunity. Prediabetes means your blood sugar is higher than normal, but it hasn't yet reached the level used to diagnose diabetes. Think of it as a warning light on your CAR dashboard. The great news is that this stage is often reversible. With the right lifestyle adjustments, many people can push their blood sugar back into the normal range. So instead of seeing it as bad news, think of it as your body giving you an early chance to act. Question 5. Why am I so tired all the time if I have high blood sugar? It does sound like a contradiction, doesn't it? You have plenty of sugar, plenty of energy in your blood. Yet you feel exhausted. The reason is simple. The sugar is stuck in the bloodstream. It cannot reach your muscles and brain where it's actually needed. You are essentially like a ship surrounded by water but dying of thirst. Once we help that sugar enter the cells again, your body can finally use that energy. And that's when people often begin to feel their energy returning. Question 6. Do I have to stop eating all carbohydrates immediately? Actually, no. If you completely eliminate carbs, you'll probably feel miserable, and most people won't stick with it. Your brain actually runs on glucose. The real secret isn't no carbs. The secret is choosing right carbs. Think of white bread like a dry pile of leaves. It burns quickly and causes a sudden spike in blood sugar. Now think of whole grains or beans like a thick log in a fireplace. They burn slowly and steadily. That slow burn keeps your blood sugar stable and controlled. Question 7. What should I look for on a food label? First rule, ignore the front of the package. That's mostly marketing. Turn the box around and look at the nutriti on facts label. Focus on two things: total carbohydrates and fiber. Fiber is incredibly important. It slows down how quickly sugar enters your bloodstream. For example, if a food has 20 grams of carbohydrates but 10 grams of fiber, it will affect your blood sugar much more gently than a food with 20 grams of carbs and zero fiber. Fiber is truly your best friend. Question 8. Can I still eat fruit? I've heard it has too much sugar. Fruit is often called nature's candy. But it comes with a built-in safety system: fiber. Take an orange, for example. The fiber inside the fruit slows the sugar down as it enters your bloodstream. But orange juice is different. Once the fiber is removed, the sugar hits your body very quickly. It's like a freight train of sugar entering your system. So the best choice is whole fruits, especially berries. Berries are lower in sugar and rich in antioxidants. Question 9. What about sugar-free snacks? Are they safe? You need to be careful here. Many sugar-free products use ingredients called sugar alcohols, such as maltitol or sorbitol. These can still raise blood sugar, just more slowly. And they often cause digestive discomfort for some people. Also remember this: sugar-free does not mean carb-free. The flour and starches in those snacks still turn into sugar in the body. So always check the total carbohydrate count on the label. Question 10. Is it okay to drink diet soda? In the short term, a diet soda is better than regular soda because it doesn't spike your blood sugar. However, research suggests that the intense sweetness may keep your brain craving sugar. So think of diet soda as a bridge. It can help you move away from sugary drinks. But the ultimate goal should be healthier options like water, tea, or sparkling water, or with a slice of lemon. Take a breath. And let's move to the next question. Question 11. Doctor, why do you check my feet at every visit? This is a very important part of diabetes care. High blood sugar can damage the tiny blood vessels that feed your nerves, especially the nerves that are farthest from your heart, like the ones in your feet. This condition is called neuropathy. When neuropathy develops, you may start to lose feeling in your feet. That means you could step on something sharp, like a tack or a small piece of glass, and not even realize it. A small cut that goes unnoticed can eventually turn into a serious infection. So when I check your feet during your visit, I'm really checking your body's early warning system. It's one of the best ways we can protect you from future complications. Question 12. How does diabetes affect my hair? I often explain it to my patients this way. Diabetes is not just about blood sugar. In many ways, it is actually a cardiovascular condition that shows up as high sugar. Over time, a high blood sugar makes the blood more sticky. It also damages the delicate lining of your arteries. This damage makes it easier for cholesterol to build up and block those arteries. And that increases the risk of heart disease. So when we work on controlling your blood sugar, we are not just protecting your glucose numbers. We are also protecting your heart for the long term. Question 13. Why does my vision become blurry when my blood sugar is high? When there is too much sugar in the bloodstream, it begins to pull fluid from the tissues in your body. This includes the lenses inside your eyes. When the lens changes shape, your ability to focus changes. That's why your vision may suddenly appear blurry. The good news is that once your blood sugar stabilizes, your vision often returns to normal. However, the long-term high blood sugar can damage the tiny blood vessels at the back of the eye. This condition is called diabetic retinopathy. That's why having a yearly dilated eye exam is absolutely essential. Question 14. What is the A1C test, and why does it matter more than my daily finger prick test? Think of your daily finger prick test like a Polaroid photo. It shows us what your blood sugar looks like right now, at this exact moment. But the A1C test is very different. And the A1C test is more like a 3-month movie. It measures how much sugar has attached itself to your red blood cells over their average lifespan of about 120 days. This gives us a much clearer picture of how your blood sugar has been behaving over time. And that helps us know whether your treatment plan is truly working. Question 15. Will I have to take insulin forever? Not necessarily. Type 2 diabetes is a progressive condition, but it is also highly responsive to positive lifestyle changes. If we detect it early and you begin building muscle, improving nutrition, and reducing visceral fat, your body can become much more sensitive to its own insulin. Many people use medication for a few years and eventually reach a point where they no longer need it. But even if insulin becomes necessary long-term, remember this. Insulin is a tool, not a failure. It simply helps your body do the job it needs to do. Question 16. Is there a specific time of day that's best for exercise? Yes, there actually is a very helpful time. Exercising about 30 to 60 minutes after a meal can be extremely effective. That's when your blood sugar is typically at its highest. When your muscles begin moving, they start to pull sugar out of the bloodstream and use it for energy. This helps prevent large spikes in blood sugar. Even something simple, like a 10-minute brisk walk after dinner, can have a powerful effect on your blood sugar the next morning. Question 17. What should I do if I have a bad day and eat something I shouldn't? First, forgive yourself. Immediately. One meal did not give you diabetes. And one meal will not ruin your progress. In fact, stressing about it can actually raise your cortisol levels, which may push your blood sugar even higher. Instead, simply focus on making your next choice a healthy one. Remember this. Consistency beats perfection every single time. Question 18. How does stress affect my blood sugar levels? Stress sends a biological signal to your body that says, danger. When that happens, your body releases hormones such as adrenaline and cortisol. These hormones tell your liver to release sugar into the bloodstream so you'll have energy to fight or run away. But in modern life, most stress happens while sitting at a desk or sitting in traffic. That extra sugar has nowhere to go, which causes your blood sugar to rise. Simple actions like deep breathing, meditation, or a short walk can calm the body's fight-or-flight response. And when that happens, blood sugar levels can actually begin to drop naturally. Question 19. What are the warning signs that my blood sugar is getting too low? Low blood sugar, also called hypoglycemia, can produce several symptoms. You may feel shaky, sweaty, dizzy, confused, or unusual, irritable. This sometimes happens when medication is taken but a meal is skipped. If this occurs, follow the 15-gram rule. Consume about 15 grams of fast-acting sugar. For example, 4 ounces of juice, or 4g glucose tablets. Wait about 15 minutes, check your blood sugar again, and then follow it with a protein snack like peanut butter to help stabilize your levels. Question 20. What is the single most important thing I can do, starting today? Instead of focusing on what you must remove from your life, focus on what you can add. Add 1 extra glass of water to every meal. Add 10 minutes of walking to your daily routine. Add 1 extra serving of green vegetables to your plate. These small additions slowly replace unhealthy habits and build the foundation for a long and healthy life. And remember this. You are not powerless. You are in control of this journey. Before we finish, please remember. This video is for educational purposes only. Always consult your personal physician before making changes to your medication or diet. Thank you for joining me today. And I look forward to seeing you in our next health conversation.